We're going to talk now about community-based engagement and participatory research and stakeholder involvement in implementation science. So, as you've talked about, I think, through other coursework, there are lots of reasons why a lot of our evidence-based interventions and programs don't actually get translated into real-world settings. So, again, a lot of that is kind of the nature of the interventions in terms of where they've been tested and the populations and settings in which they've been developed. Some of that has been about the interventions themselves being kind of complex or costly, the interventions not being that accessible or not being ready to, easily usable, not always being seen as kind of being relevant or addressing priorities by stakeholders, or not being kind of available for certain populations and settings. And then again, a lot of it relates to context. The contexts are messy and complex. We have competing demands and resources and time. We have multiple stakeholders whose needs we're trying to meet. And organizational culture and leadership are not always easy to get on board in terms of adopting and implementing new programs. And then in terms of our thinking about historically some of the research environment, researchers have not always been incentivized to communicate and disseminate their research, and funders have not always made researchers accountable for thinking about dissemination and implementation. And I think kind of underlying all of what we've discussed and all of these challenges, I think, is that point that we need to do better, or researchers need to do better in terms of thinking about involving stakeholders and community members, again, not just at the end when we're thinking about trying to implement, but from the beginning, when we're developing our interventions, when we're prioritizing our health topics, and throughout that whole research process, all the way through the continuum of development, testing, through kind of adoption, implementation, and sustainability. So I think that is a key message. So what has that looked like in implementation science? So Larry Green has been kind of one of the pioneers in implementation science, and he has this quote that I love that says, if we want more evidence-based practice, we need more practice-based evidence. And sometimes people have talked about this push-pull model, and the push being this idea of like kind of pushing out our research and our interventions. And he makes the case that we also need the pull. We also need the engagement, or this whole kind of puzzle just doesn't work. So I like that quote from Larry Green, and he's done a lot of great work on kind of thinking about and conceptualizing what he calls practice-based evidence. So who are our stakeholders? So again, this really needs to be contextualized and specified for you and the work that you do, but this is really a broad spectrum of potential partners, everyone from community members to patients to implementers to policymakers to the public to providers. It could even be academics from different disciplines that are outside. And again, it's really about identifying who you need to have at the table, who needs to be involved to really ensure that the program that you're going to be designing, delivering, encouraging the adoption and implementation of this program and evidence, that they're involved, again, early and often in the process. So participatory approaches, these are not new. It's really an orientation to research, not a research method. And again, it's really about the engagement of all key partners throughout the research process. There's work suggesting that it can improve the quality and relevance of research. It can enhance the commitment to action as part of the research process, and will ultimately increase the likelihood that the research will actually get translated. And again, there's really a continuum of participation and engagement. Some people have talked about this in terms of kind of helicopter science, where community members may just be included as study participants, but might not actually influence the design or the research questions or prioritization of the health issue or selection of the intervention. And then you can kind of think about this as a continuum with varying levels of engagement, with the highest level of involvement and participation as CBPR, or community-based participatory research. This is when there's what's thought about as really equitable power and resource sharing, and where community partners and community members are making key decisions. They are at the table in terms of developing the design, and they really have ownership. Some of the principles, so Meredith Minkler, Barbara Israel, there's been a lot of, Edith Parker, there's been a lot of leaders in this area. And again, this field has a long history, so this is not new work. And again, a lot of the principles of CBPR relate to kind of recognizing community as a unit of identity, thinking about kind of a strengths and resilience and resource or asset-based approach to understanding communities, not just a kind of a risk-based approach, thinking about facilitating collaborations and partnerships, thinking about what, knowledge and actually creating action, not just creating knowledge for knowledge's sake, but taking action from the knowledge that's created, thinking about co-learning and providing opportunities for empowerment that addresses some of the inequities, not just the health inequities, but the social inequities, and power sharing that needs to happen. It's often kind of an cyclical or iterative type of process. It tends to be more ecologically oriented, so it tends to focus on things more broadly with the social determinants of health perspective. And again, a lot of the foundational work is that the findings are not just published, but that they're actively disseminated and to all partners and acted upon. And again, when we think about how CBPR might address some of the challenges of translational research, it gets around issues of limited external validity by actually engaging stakeholders in the adaptation within real-world complex settings. When it thinks about evidence, it's not just research evidence. It's thinking about spaces for co-learning and hybrid knowledge and kind of this bidirectional learning. It has us really get beyond some of our jargon and terminology that might be in the research world and broaden our discourse so that it's meaningful and resonates with kind of real world cultural and social meanings. It has us think about, again, shared resources, collective decision making, and outcomes, so selecting the outcomes so that they're meaningful and beneficial to the community and actionable. It has us think about, again, sustainability from the beginning through kind of local ownership and capacity developing. And it might use formal agreements and kind of partnerships to equalize and kind of promote mutual benefit to address issues around trust. So see, these are some of the kind of foundational works that have happened. And here's a citation from Nina Wallerstein that might be helpful in this area. So how can it be applied in D&I? Because again, this is a huge field and there's already a lot of work that's been done. But I think it's really useful from an implementation science lens to bring this piece in. Again, it's helpful to think about and understand the strengths and needs of the community prior to trying to think about adoption and implementation of a new practice. So instead of wasting a lot of resources and time thinking about from the start engaging the stakeholders to understand what's going to work here. Is this appropriate, acceptable, relevant? If not, how can we adapt it? And really, again, thinking about stakeholder involvement and buy-in through all stages. As we're thinking about the outcomes that we're going to prioritize. Is it cost? Is it sustainability? What's most meaningful for your partners? Shobha Ramanathan has a great piece from 2018 on participatory implementation science that I think can provide a nice model for this and really talks about engaging stakeholders in kind of the co-production of knowledge as well as thinking about the solutions, which might be the implementation strategies or dissemination strategies we've talked about. And again, it goes through a lot of the same principles that we talked about as underlying CBPR, but has us think about it again from an implementation science lens, again, with the goal of addressing disparities and promoting health equity. And again, she also talks about this spectrum. Again, CBPR is kind of the most one end of a continuum in terms of what this might look like. Again, of kind of full engagement of community partners, but there are other models that people have used, and it's important to work with your stakeholders and your team in terms of what this is going to look like. There's many benefits, and again, Shobha has detailed these in terms of involving them and the community partners in the selection of the issue or evidence-based practice, and how that's going to increase the relevance and impact of your implementation science efforts. It can help with the actual study delivery and the evaluation. It can really be critical in terms of data analysis and interpretation as you're trying to understand why implementation did or didn't happen. Again, engaging and involving all those diverse stakeholders, as I talked about, can really provide some insight. And again, not just doing this quantitatively, but thinking about this from a mixed methods approach, I think is really critical. Again, this can help build the evidence base, and I think particularly build an evidence base, again, with an equity perspective, which has been, I think, the empirical evidence, we've had less knowledge in implementation science about this, and particularly in community settings. You know, so much of the implementation science work has been in clinical settings, so I think there's a real opportunity to understand and learn in community settings. One great example is from Meredith Minkler's work in the textbook chapter from the first edition of the Implementation Science textbook. She has some great examples of some work she's done on using CBPR to not only identify some of the key issues around worker health and safety in Chinatown restaurants in San Francisco. These are some of the partnerships she talks about, how she engaged them. I mean, the workers were helping develop and identify the items, help document the issues, and then she had some amazing dissemination and implementation strategies around policy, around community organizing, and ultimately they got a low-wage worker bill of rights that happened as a result of some of this work. So her work is really a wonderful example of this in practice. There's some great resources and tools, the community toolbox, the community campus partnerships for health, if you're interested in learning more about some of these practices. And again, this is not specific to implementation science, but I think there's a real opportunity and interest to bring this into implementation science.